Getting a dental implant is a serious medical and financial commitment. For many, booking that first consultation feels less like a step toward a restored smile and more like walking blind into a sterile surgical room. A legitimate consultation begins without clinical tools or surgical pressure. It is a conversation. Your oral surgeon needs to understand the person attached to the teeth, reviewing your complete medical history and systemic health before any physical work begins. Clinics follow two distinct approaches. A surface-level assessment prioritizes the transaction, offering a quick visual check, standard price quotes, and surgical pressure. A comprehensive diagnostic assessment focuses on biological mapping, identifying nerve pathways and bone volume to ensure long-term success. If a clinic treats this initial meeting as a financial transaction rather than a rigorous biological test, the risk of future implant failure increases significantly. The fastest way to evaluate a clinic's quality of care is to look at their diagnostic technology. This diagram shows a standard 2D panoramic X-ray, providing a flat view that leaves root structures as blurry estimates. This forces guesswork when locating vital nerve pathways. Because 2D scans cannot show jaw depth, they cannot guarantee a safe distance from nerves during surgery. The modern standard is the CBCT 3D scan. It provides a high-definition, 360-degree topographical map of your entire cranial structure with exact millimeter measurements. This allows the surgeon to measure bone thickness and flawlessly map nerve canals before a scalpel ever touches your mouth. Demanding a 3D scan often involves an upfront fee, even during a free consultation. However, this precision virtually eliminates the risk of accidental nerve damage during the procedure. Beyond technology, the success of the implant depends on your physical ecosystem. Conditions like diabetes or medications for blood thinning and osteoporosis dictate how the surgeon must modify your antibiotic regimen and surgical protocols to ensure the bone heals correctly. During this review, specialists frequently find a common anatomical roadblock: insufficient bone volume to support the titanium post. This is bone resorption. When a tooth is missing, the jawbone loses physical stimulation from chewing. Without this pressure, the bone naturally melts and shrinks. A bone graft serves as a routine structural reinforcement, rebuilding the site so it can safely anchor the titanium post. This step increases the total cost and adds several months of healing time to your treatment plan. Proceeding without a necessary graft to save time results in an implant that lacks structural support, which eventually leads to catastrophic failure. While the surgeon examines your anatomy, you should be evaluating the clinic's operational standards. Use this checklist to verify their specific track record. Ask the dentist about their monthly implant volume. You're looking for a dedicated specialist who performs this surgery daily, rather than a general dentist who only places implants occasionally. Demand to know the exact brand of the implant materials. Globally recognized brands like Straumann or Nobel Biocare have decades of clinical research proving their durability, unlike cheaper, unproven budget parts. Ask for their written contingency policy. You need to know what steps the clinic takes if osseointegration fails and the bone does not fuse to the metal. A reputable clinic provides these answers with total transparency. Their willingness to offer written warranties proves you are investing in surgical skill and proven materials. Once your questions are answered and the diagnostics are complete, the clinic will map your timeline. Because a successful implant is a biological restoration, it requires patience. For a single tooth replacement, the journey starts with extraction and bone grafting. Next is healing phase 1, taking 3 to 6 months to solidify. Then comes the titanium post insertion, another 3 to 6 months for bone fusion, and finally, the permanent custom crown. Immediate same-day timelines are usually reserved for full arch procedures like the all-on-4 method. They rarely apply to single teeth that have been missing for several years. It is often tempting to choose a provider based on a quick, free consultation that promises immediate results. But your oral health is not a marketing promotion. Use the 3D technology standards and the vetting questions we covered today to find a clinic that prioritizes your biological safety over a quick sale.